Good afternoon, everyone, on this Sunday afternoon, and welcome to the second webinar session brought to you by MedVirtuals. MedVirtuals is a brainchild of Dr. Deepak Patkar and Dr. Amit Guntar. As we all know, the last year has been a very challenging one for all of us, and especially students all across the globe. But in spite of these difficulties, under Sir's able guidance, we did manage to conduct several academic activities, which received a tremendous response from students all over. So to keep this enthusiasm for learning going on, we're bringing you this new platform, MedVirtuals, which will focus not just on academics, but also on providing guidance and counseling for students who are aspiring for career options abroad. There are a lot of questions which students have once they finish their basic graduation, and our aim is going to be to get these answered to the best of our capacity. Since we received an excellent response and several queries in the last webinar, which is more of a generalized nature, we decided to come up with a second session with a more specific approach towards pursuing education and career in the UK. In order to get you the best of both worlds, we have collaborated with our team from UK, wherein Dr. Shashank will be our advisor and will be providing the necessary guidance. As far as today's webinar is concerned, we have an experienced panel consisting of representatives from GMC and also experienced doctors working in the UK who will try to provide you the most relevant and authentic information possible. So thank you so much for joining us. Um, Next, I would like to, before we start this session, I would like to invite Dr. Shashank Patil to please share his views. Sir is an alumnus of Nair Hospital from Mumbai. He's done his membership in surgery and fellowship in emergency medicine. He's a consultant and director for emergency services at Chelsea and Westminster Hospital in London. He's a senior clinical lecturer at King's College London, a senior clinical lecturer at Queen Mary University in London. He's co-chair for the London region at the Royal College of Emergency Medicine. He has a keen interest in clinical research, healthcare informatics, and management. Thank you so much for joining us, sir. Sir, over to you.
Thank you, Gauri. Sorry, let's just mute out because yeah, thank you very much. Thank you for the generous introduction. And should I tell you what's best to hear hear from me is this lovely collaboration, because for last few years we've been engaging with Indian doctors who are interested in moving from India and getting higher educations in a foreign land, UK still being one of the most popular places. And being through the journey, it is way beyond education. It is not just educational challenges, it's personal challenges. It's about choosing regions, it's about how to manage your lifestyle after getting, when you arrive, middle of it, subsequently. And once you're here for a few years, you know what's right for you. The information nowadays that is available, should I say, is more compared to what we had uh, in early 2000s, when we hardly had used to have any information. But then it is better not to have information and find the right one rather than have too much information, which is the problem currently, where you can find everyone and everything on internet. And I think what's very important from this sessions that we are going to conduct is hearing from the right people. So our last session was, as Dr. Gavirani mentioned, it was very generic. However, this time around, we are going to focus on a couple of specialities. And I think what you need to learn from or know from these guys is your key questions. When the speakers speak to you, find out where you fit in the journey where the speakers have had, and ask questions from their journey so they can help you. Me in the background, I can try and help you with me, myself, and there's Dr. Naveen Kirti who will be speaking next. Together, we'll try and explain and help you understand longer or bigger questions beyond specialty. Of course, we can give you idea about specialities as well. But use today's session to see where you are, what's your journey like, where you are in the journey, and ask questions related to your journey. And I think it will be very productive for you. So I think it's about engagement with the relevant questions, and keep an eye on the chat rather than asking the same question. So it will be more we can absorb more questions because time is always a limit. So without further ado, I think I'll hand over back to Gauri for the next part. Thank you very much.
Thank you so much, sir. Thank you. Uh, Next, I would like to invite Dr. Naveen Kirti to please share his views. Sir is a doctor entrepreneur in UK. He's a part of the NHS England's Clinical Entrepreneur Fellowship Program. He's a team doctor for Silverstone circuit covering the Formula One and MotoGP events. He's worked with NHS predominantly in the trauma sector. He's a team leader for the 2018 TEDx NHS event. He's done a mini MBA from Stanford University. He's a co-founder of doc2uk.com, which is an innovative digital recruitment platform for NHS hospitals to recruit high quality doctors directly from overseas. Thank you so much, sir. So over to you.
Thanks, Gary, for the intro. Hi, everyone. I'll try to keep it brief. And as Gary said, that just like you all guys, I moved from India to the UK, not now, but then 15 years ago. Went through the journey, not so straightforward and easy, but then it was a bit convoluted. Most importantly, because my expectations were different to what exactly reality was. And I managed to squeeze through the system, and obviously I'm settled now, and then I'm very happy here. But it was not necessarily the case for everyone. So we thought like conducting events like this will help basically anticipate and understand how the system is different. So you can make that decision much ahead rather than a bit too late to go or not go. And then if you come to the UK, how to settle down and how to progress in your career. Very importantly, I'll show you one important slide. Sorry. Sorry, I need to share my screen. But anyways, the most important thing what I'm trying to say is like the journey to become a consultant in India is like you do your internship, 3 years, you do your post-graduation, and you're ready to become a consultant. It could be a junior consultant, registrar, but then in 2 to 3 years, depending on location where you're a consultant. Essentially 3 years from the graduation point, you're a consultant. Over here, it's quite different. It takes almost up to 10 years from the time you graduate to become a consultant. This is the important thing. And there are 2 routes to become a consultant when you come from overseas to work in and settle in the NHS or in the UK. Our 2 speakers essentially have used both the pathways. And that is what actually we thought like, because for us, the important aim is like how to settle down and then how to progress in the career and how to become a consultant. Once you become a consultant now, how to progress in your consultant role as well. Like what Shashank is currently doing. He's a consultant in emergency medicine, but then he has taken up multiple other responsibilities as well. The first speaker is Mohit. I met Mohit 2 years ago in one of our recruitment events. By the way, Dr. UK is a recruitment agency. And what we do is like we have networks into the NHS, hospitals who are recruiting or looking to recruit doctors. We connect them to the doctors from, say, overseas, mostly from India, just like someone who are like us, and then introduce them. And we give guidance to these doctors. So in one of our recruitment events, I met Mohit, a very impressive boy. And he's been here for a year. And then he cracked into the system, particularly in general surgery. We wanted him to, and this is the long part, but then what we call as the training part. So we want him to share his experience of what he found and how he found it, and then how he is settling into the system. The second speaker is Usha Chalasani. She's a radiologist. She has worked for 4 to 5 years in India. And after that, she has taken up the alternative pathway, what we call as the Caesar pathway. So within 3 years of coming to the UK, she became a consultant as well. That is about Usha. The final speaker is Steph Styles. She is the International Applications Manager for GMC. So every single application goes under her radar. She's got a team of, I think, 10 or 12 who review all applications and then validate them and then provide them or give them the GMC registration. So that's all about us and me. I guess we are bang on the time. So we'll get Mohit to start speaking. Mohit, are you ready? You're on mute, Mohit.
Yes, Naveen. Hi, hello. I just need to share my screen, which is a pain nowadays.
So any questions, feel free to reach out through the chat. We'll pick up. And then there are some questions for JMC as well. I'll ask JMC, Steph. And I think it's important to, do not hesitate, and then feel free to ask any questions, however silly it might seem. We'll answer the best we can.
Hello. Yes.
Yeah.
Hi.
Yeah.
Is my screen visible?
Yes, it is visible, Mohit. I'm
All
going
right.
mute,
So,
and then all up to you now.
Sure. Hi guys. So my name is Mohit Gupta, and I'll start by telling you a bit about myself. And this is not essentially to show off, but just to tell you so that you can relate, and see if this pathway is for you. I cleared my MBBS and graduated in the year 2015. After which I got selected for a DNB general surgery training program, which I pursued in New Delhi. I finished in the year 2018, after which I joined senior residency in a government hospital like most in New Delhi. During this year, I cleared my MRCS and managed to get a job in the UK. Now, I came to the UK in January 2020 and joined as a trust grade non-training registrar, that is a senior clinical fellow in Bedford Hospital in colorectal surgery. 2 months down the line, I applied for a national training number and was lucky enough to be successful. And currently, I'm a renal transplant registrar in Portsmouth University Hospital under the deanery of Wessex. So I'm going to start by introducing you to the one and only negative slide in my entire talk. What training in UK is not. So it's not quick. It's not a 2 to 3 year program. It is basically your life for the next 6 to 8 years. And so it's your mid-adult life. Now, what you would get out of it is that after these grueling 6 to 8 years, you will be what we call as a day one consultant. You would get something called as a CCT or a Caesar CP, depending on the pathway you take, along with an FRCS or FRCP, according to your specialty. You would basically have half of the world be ready to give you a job. You would be safe and competent consultant as per UK standards. So I'll just take you through what training in UK is like, and I'll also try to draw some comparisons with the Indian scenario so that you can see where you are at, where you need to be, and if you need to go through a particular route. So typically, somebody in UK, after they graduate, they enter something called as foundation training, or FY. Now, it is divided into FY1 and FY2. At the end of the first year, that is the FY1, they get full GMC registration. So you can relate this with having completed an internship in India. Now, after that, they go on to their FY2 year, at the end of which they enter a competitive scenario, much like you can compare it with your NEET pre-PG exam. And they enter into something called as core training, which goes on from CT1, CT2 to CT3 or up till CT2. Now, this can be equated with PG training in India. After that, in this time, they give their exams like MRCS and MRCP, after which they have another scenario, which you can compare with the NEET super specialty exam in India. This is the national interview or the national selection process for getting into higher specialty training. Now, this is like, you can say, super specialty in India, where the only difference, as Naveen already said, is that you go on from ST3, that is specialty training 3, up till ST7 or 8. So it's a long 6-year program. After that, you are awarded a CCT and you can enter a specialist register. So now, well, it is indeed possible because, especially nowadays, there was something called as a shortage occupation list. Now, I think in around May 2019, the medical practitioners were entered into the shortage occupation list, by which there was earlier a rule called as RMLT, which means resident market labor test. Long story short, according to this rule or law, UK graduates or British citizens would get some sort of an advantage or priority in these training programs. However, since we are now exempt from this, essentially, that means an overseas doctor, are at par with a UK trainee to get into higher specialty training. So let's have a look at some stats. Now, if you can, this is the data from 2020, the year which I got in. For example, in my specialty, it means that around 574 people applied, and every fifth person got a job, got a training number. And this number is considered to be competitive in India, because if you see certain other specialties like genitourinary medicine, or say metabolic medicine, or rehabilitation medicine, they were essentially every second person would be getting a job. And there was some like psychiatry where everybody got a job, and there are some like old age psychiatry where there were more jobs than applicants. Whereas there were other specialties like neurosurgery where the competition ratio was quite high. So I guess all of you who are here would realize that you have gone through a much higher competition ratio, or much more competition in India to reach probably where you are or where you plan to go. So yes, it is quite possible. Now, the only thing which I would want to tell you is that this RMLT is regularly reviewed, and it might not last forever. So I feel this is like the golden era to get into a proper training pathway in the UK if you are at that stage of your training or career in India. Now, I'm going to give you 3 basic rules or tips, if you may, which I followed, which have tremendously helped me being successful at this process. Rule number 1. Now, it's simple and cheesy, but trust me, this is something which has worked wonders for me. When I came to the UK in January 2020, I was just settling in. And I came to know about, and I was constantly inquiring about how to get into training, etc. And I came to know about this pathway. And I was a bit reluctant that I'm just settling in. I need to, work on other stuff like where to stay, how to get a phone, etc. But there was something in the back of my mind which told me that I should apply for this interview. If nothing else, it would be good practice for next year. So I made an application, and there was one point where I was stuck, which is that I needed some sort of a form showing that I was competent to enter higher specialty training, because I had not trained in the UK. So this was a CREST form, they used to call it. And it was written on the form that, any consultant who would be signing it would have had to work with me for at least 3 months. It was just 2 years since I was in the UK, 2 months since I was in the UK. I went up to my boss and I told him that, please tell me that you cannot sign this form so that, I can rest and I wouldn't have to, work towards this thing. He told me, yes, you're right, I cannot. And I was just, I think, some 15 days short. And then he said that, yes, I cannot sign this form, but if you read carefully, you can get this signed by somebody you've worked with outside the country as well. And I was like, okay, now I need to, since it's possible, I need to do it. I emailed my boss from India, and he was very prompt. He did all the formalities overnight and sent it to me. And that is how I applied. And well, I mean, it worked. So again, long story short, guys, don't be shy. Do not put it off for another year. Do not let anybody tell you that you're not good enough. There'll be a lot of people around to do that. Uh, just get up, dress up, show up, and fill in that application form. Go for the interview. Do not be shy. Now, my second rule: information is power, not knowledge. Information. So it is. The UK system is different. It is not going to be that one gene or that one chromosome which is going to change your life forever. It's going to be relatively simple things like when are the interview dates, how do you apply, what is the marking scheme, what evidence are they looking for, and how are you supposed to give it. So this is your one-stop shop uh, for accessing this information. oriel.nhs.uk, and an important part about this website is that you can register on this website without a GMC number, sitting in your own country, and make an application. So I would recommend you go, if you are at all interested in the training pathway, go on this website, look at, they have like a big resource bank, look at different things, look at the FAQs, and even look at the interview date so that you can plan ahead. Now, well, instead of getting into the specifics of how what the exact process is, I'd like to tell you something about the selection process for higher specialty training in the UK. Like coronavirus, it is constantly mutating and evolving. In fact, I feel that because of COVID, it is evolving at a very rapid speed. So when before I had come rather, in 2019, 2018, they would have a face-to-face interview process, much like the second part of MRCS or the third part of MRCP, where they have stations and they assess you on different aspects. Last year, because COVID struck, they introduced a new process called as an assessment form, where you were supposed to submit evidence because obviously you could not meet face to face, and that is how the ranks were decided. Now, this year, they have kept that assessment form and further introduced an interview after this assessment to determine your rank. And this is not they've tried to kind of emulate the original interview. So I do not know when and if COVID will ever end and we'll go back to that phase. But being in the NHS and going through the selection process, I have realized that these people, they work on some core values, and if you understand them and try to excel and master them, no matter what selection process would be in place next year or the next year, you stand a good chance. So, well, now, as I said again, it's not about clearing an exam, because mind you, everybody who would have applied for the interview would have cleared this a membership exam like the MRCS or MRCP. Now, what they look for as a trainee and as eventually a consultant in the UK is not somebody who is good at solving MCQs. It's about your other skills as well, like your leadership skills, your teaching abilities, your research orientation, what presentations you've made, your management skills, publications, audits, quality improvement projects. So essentially, you would need to create something called as a portfolio, which is some evidence, documentary evidence, showing your competency as a trainee or as a doctor. Now, there is something called as fear of the unknown, and even I was a bit apprehensive about, will they accept the evidence which I have, and I didn't have a lot of Royal College courses or seminars back then. But if you think of it, if I've been, or if somebody has been in India for the last 3 years, how the likelihood that they will have more experience and documents from India, that's logical. So whatever evidence you have to get it validated and submit it, and the rest is up to them whether they accept or reject it. And I think they're sensible people. So especially for surgical trainees, there is an issue of the logbook. Now in the UK, they have an electronic system of recording your cases. When I was applying, it wasn't open for overseas doctors, and I had a paperback logbook which I validated and created a summary, got everybody to sign it off, and submitted it. You can do the same, but luckily now they have introduced registration for overseas doctors. So if you have that like some time, you should retrospectively put all your cases on the e-logbook platform, get it validated by a consultant, and retrospectively submit this evidence. If you are short on time, I feel you can retain your older evidence, but at least prospectively register on this website and start uploading cases as you go. So secondly, there is something called as the ISCP website. This is also extremely important. It is the Intercollegiate Surgical Curriculum Program website, which is basically a conduit or a platform to update your evidence. So in the UK, you have things, you are evaluated via things like CBDs, KEXs, PBAs, MSFs, a lot of alien terms which are, trust me, scary. But these are basically case-based discussions, evaluation exercises, and the procedures you do. So if you do a particular procedure in the UK, it's not that it just goes in your logbook. You have some sort of a feedback session with your trainer, discussing what you did not know, what you knew, what you were good at, what did you learn, what did you feel about these things. And initially, yes, I did think it was a bit overboard, but retrospectively they do add to your learning. So try to, no matter what stage you are at in your career, try to inculcate this in your practice. Again, this is a website where you can register even as an overseas doctor now, and without a GMC number, you can use your state medical council or national medical council number to register. Right. So there's another practice called as a multi-source feedback, which they value a lot. So basically, you can do the same thing in your hospital where you currently work. If you are planning to come here, you just need to send out a few forms which are available on ISCP to different consultants you work with, your colleagues, your juniors, nurses, and even patients. And they give you a 360-degree evaluation of the type of doctor you are. And these are the type of things which the NHS and the HE actually look at. Right. So courses and workshops. Well, I would recommend for surgical trainees ATLS, which is global. It's an international standardized thing. The CRISP course, which is a course for looking after critically ill surgical patients. Now, the CRISP course also, these courses are also held by, conducted by the RCS, and the CRISP course is also held in Pune. In fact, it's 1/6 or no 1/10, around 1/6 or 1/10 of the price available in the UK. So if you are in India, I would highly recommend you take this course. Or you can have done some similar course which is equivalent, which follows the same principles in your own country. There is another course which is essential, the basic surgical skills course. Again, it is conducted by the RCS, and that is the one which they would want you to take. But like, for example, I had done a pilot. I was a part of a pilot project run by the National Board in India, where we do have a national program for basic surgical skills. So, I mean, it's a nationally conducted program, so it was valid. There are other courses like basic, intermediate, and advanced laparoscopic surgery, which is held by the RCS. There would be similar courses conducted in India. You can obviously do them, and guys, always collect certificates for these things, documenting that you have spent your precious time and learned something. There are a lot of cadaveric surgery courses, and also if you you already would know that a lot of these conferences have 1 or 2 or 3 day workshops. These can be counted as well. So no matter what type of evidence, please collect it. Now, when we talk about management skills and leadership qualities, it can range from anything. Like, you could have organized a conference, you could have been part of the organizing committee, which PGs usually are. You may be, as a senior, a rota in charge of allotting duties to your juniors or even to colleagues, to interns, for example. You may have held a post in some sort of a college committee. Like, I was the head of the literary committee or the debate committee of my college. You may have been the school head boy or head girl. Hell, you might even have been captain of your football or cricket team. So essentially, you are looking, they are looking at your ability to manage, your management skills. And if you can lead, it can be in anything. So whatever you do, please get documentary evidence showing your competencies. Because essentially that is what they are looking at. Somebody who can be at a responsible post. And these are essentially the qualities of a consultant in the UK. Now, teaching. Well, we do a lot of teaching, knowingly or unknowingly in India. As PG students, you have responsibilities to teach sometimes the undergraduates, the interns, your juniors. When as a senior resident, you might have taken some lectures, tutorials. You regularly would be doing board-based teaching, even if you don't want to. You may have been a faculty in some course or workshop. What we do not do is we do not collect feedback. I would recommend you can create or download, set feedback forms, or even create your own and distribute it to the people you teach, which will be considered as definitely superior evidence in the UK. It's not about doing things, it's about doing things right, I feel. Now, after you have, gathered this evidence before applying, I would suggest go to the HEE website or Oriel website and read the FAQs. There is a reason they are there. There is, on Oriel, you can even find the medical specialty applicant handbook. Read that, go through the person specifications. You should be knowing what is supposed to do on that, in that job where you apply. There are a lot of helpful websites like the Savvy IMG or ST3 Recruitment, which is a compilation of people, speaking about their experience. Go through that. And after all of that, before applying, if you have any doubts, please write emails to the HE support or real support if you don't understand something. Ask successful applicants or current trainees for help, and narrow down your questions. That's why I recommend that you read before, so that you can ask crystal clear questions and make it easier for people to help you. Now, my third rule, which is again a bit mainstream and cheesy. Please stay away from negativism. There will be a lot of people coming and telling you that there is racism, there is it's unfair, and it's impossible being especially going into a surgical branch, etc. That's not true. I feel that the British system till now has been extremely fair, and they evaluate you and judge you for what you are and not where you come from. So please shun out the negativism, filter out the crap, and use your brain, follow good advice. So I guess this is the end of my talk. And at the end of the day, you can be either the person who is a bit lazy, gives excuses, or you can be the person who just gets into it, gets the job done. So I would recommend be proactive, ask, inquire, and apply. So I guess yes, that's it. It's the end of my talk. If there are any questions, I'll be happy to take them. I can't answer everything because I'm relatively new in the system. It's just been a year, but I'll try my best.
I'm muting myself as well, just in case if there's a bit different question unrelated to surgery, I could chip in. We did answer a few, and I can see
Thank you,
a lot
Dr.
of.
Mohit.
Yeah.
Naveen sir, yeah. Yes, you can go on.
No, if there are any questions, actually feel free to ask. We have another 7 minutes for our next speaker to join in. That is Usha.
Yeah, there are a couple of questions in the chat box, so I think we could take them.
Okay. Shashank, you want to join in as well with these discussions?
Naveen sir, you're not really audible.
Yeah. I think it's a good time. As you said, we have few guys who are asking a few questions. So, should I say, as a rule, can we just try and focus because we have got Mohit here with his, I think, what he has spoken, and what I liked about the entire thing is shunning out the negativity. Okay, because that's a common excuse everywhere we find, and it's a very important point. If you have this mindset that people are there to get you, I think that's where you are actually not in the right
Yeah,
direction. Yeah.
yeah.
You start getting,
Particularly about, I want to make a point about racism. I mean, I strongly believe if you go looking for racism, you will find it. Like it's it's more like whenever somebody tells you something, you actually have to. They have this practice in the UK called reflection. Think about what you have done wrong, because anything can be concluded as racism. But if you look back into what you have done and how you can do it better, I have found whenever I've been told something, it's always been in my benefit.
thank you. So the key points over here
So
is where you are on the surgical journey, whether you are a post MBBS and thinking of a surgical career in UK, whether you are post MS, post DNB and thinking of going through this another training program in UK with further subspecialty, or you're already a post MS with few years of experience and wanting to go and complete some form of program which may lead to a consultant job in UK. You are at a different stage of journey, but the principles are still the same. You really need to engage with people who have gone through the process, understand what is the requirement at your level, what are the regulations which are currently at your level in United Kingdom, and then approach it. And very very important point, if you already have certain uh, if you are in India in certain part of your journey, start collecting evidence right now. What we said, it's not just evidence, but start validating it. Sit down with your supervisors in India every year and say this is what you have done. Get some form of educational stamp on it. I mean, this is what you have to do. I mean, we haven't gone through, we haven't trained through this process, but if you start doing it, you will realize and that you're already halfway through journey, but also you'll get a self-satisfaction that, oh, well, I'm really not that bad. My last year has been very productive. So for personal kind of encouragement and motivation, it's good as well. So there are lots of questions popping into Q&A. I'm not able to keep a track on it because it's
mm.
not coming on a general box. But Gauri, if there is anything you want us to talk till we go on to the next speaker.
The one question that's been coming up very often is US Emily versus Flab. Which one is better? I think that's
Naveen, we are going to look at you, mate. You've been through this.
Yeah, I think I've made a note of this. I think it's around here. So I did my USMLE before I did my lab exam, but this is back in 2004. And I applied for visa. I didn't get it. I did my IELTS and lab, and then came over here. In 2010, I went to US after finishing my step 2 CK and CS. Uh, if you have to make the decision, US or UK. If you are destined or sure about going to US because there are multiple benefits, that's altogether a different discussion. Which is better?
I mean, your volume is a bit low, so I think the attendees cannot hear you clearly. I think you just need to connect to the computer audio or something. I don't know, some setting.
1 second. Sorry. Um, is it any better now?
No, it's coming
No.
very low.
Still low.
Sorry.
Can you just switch to your computer audio maybe and use the headphones?
All right. In the meantime, I can take that question. Um, from a surgical perspective, I would be recommending something which is not. I don't think a lot of people will be telling you. If you are at that level, you are, doing your internship and you're preparing for NEET as well in India. Guys, trust me, the amount of time we spend on studying, I personally feel you should give both USMLE and a PLAB. The reason being, the exams will be clearing the exam will be just a byproduct of all the effort you're putting in. And trust me, I have friends who have been successful in the training program who are ST3s with me and who are now, taking up preparing for USMLE because they want to, further go and do some sort of a fellowship and practice in the US. So might as well do these things when you are already studying. That's what I would say. If you can, you should definitely knock on all doors and keep all your doors open.
For me, I'm not sure if it is any better audible now.
Definitely
Okay, fine.
better.
That's good. Very important, actually, as much as we want to practice overseas, one of the important factors is the salaries. An average doctor here in the UK earns around, say, 100 to 110,000 pounds per year. But this is after you become a consultant, or 120,000. But the same an average consultant or a clinician in the US after 5 years of working in the US earns around $350,000, which is like around 280,000 pounds. There's a big gap, but then it's much harder as well to get into the US system. So the discussion USMLE or PLAB is kind of left to you. I personally, something which has happened, the GMC person is going to speak as well. Steph is going to talk about it, which never happened before. Only this January, what GMC have done is like, earlier you have to do only PLAB or MRCS or MRCP FRCR to get GMC registration to work in the UK. Just January this year, they said that if you do your USMLE, you can work in the UK as well. So as Mohit pointed out, aim for US, do your USMLEs. I'm not sure if Steph is here. Do your USMLEs. If you don't get into US yet, come and work in the UK and then decide. If you like UK, stay here. If not, because you've already cleared your USMLE, move to US. And this is a good stepping place as well.
Very important point. Naveen nicely explained you the financial gains that you might benefit by going by crossing the Atlantic. But very important point over here is quality of life. Okay, you are not going to be young forever. You're going to have families, or you probably have families. You need time for them. You don't want to be one of those because yes, money sounds good, but to earn that money, it's directly proportional to the time you put in, how much compromise. And one thing I can tell you, I've been in this journey for a long time now. I have so many roles. Despite that, I can tell you my quality of life is definitely good in UK because of the rules around working time directives. And that's a very important aspect when you consider decision. Finance, of course, one of those things, but equally important is your quality of life. I'll stop over there. And
I
any,
agree with.
Sorry.
No. I'm just going to reiterate. I agree. I stayed back despite, as I said, in 2010, had the opportunity to go and work in the US. I personally chose to stay back in the UK for this reason. I enjoyed it. Quality of life, multiple factors helped me. And then I'm quite happy that I'm in London or in the UK. Yes, it's time for actually Dr. Usha Chalasani. She's an FRCR radiologist, just like you guys. I see there are quite a few radiologists over here, so maybe Usha's session will be very helpful for you. Usha, up to you.
Hello, good morning, everyone. I think it's probably afternoon in India. So good afternoon, everyone. So I was just looking at the chat section and I do see a lot of questions on FRCR and radiology. I'll try to cover as much as possible during my talk. If there's anything extra, let me know. I think my talk will be very useful for the radiology trainees. I can give a little bit of tips for other trainees, but for surgical trainees, I think Dr. Mohit has covered quite a bit. So I think he has given a lot of information for them. So let me just try and share my screen. Bear with me. My mind is not opening.
Naveen, do you have a copy of the slides? Then you can run it for. Oh, brilliant. There she is.
Yeah, we can see.
Just going back. Right. So I think Dr. Naveen has already given the introduction. So I'm Dr. Usha Chalasani. I'm one of the consultant breast radiologists at Worcestershire NHS Trust. And I also lead the breast unit at Y Valley NHS Trust. So it's just a brief overview of my journey and how over the years it has helped me to become a consultant or stay in a consultant post for long. Just a brief overview. So this is just showing a snapshot of UK consultant journey. Webinar have done anyway.
Ma'am, sorry to interrupt you. You're not very clearly audible.
I'm not audible.
Yeah, no, it's fine now. Yeah.
Okay. Maybe I'm just. Is it better now?
Yeah.
Okay. So I have done undergraduate and postgraduate training in India, after which I worked in India for about 4 years before joining NHS. So I work at 2 hospitals at present. One is Y Valley NHS Trust, where I do symptomatic breast radiology. And the other one is Worcestershire NHS Trust, where I do screening breast radiology. I've kind of subspecialized myself into breast radiology. So that's what I practice more at the moment. This is just sort of going back on my journey in the last 7 years and how, why I have come to UK. There are different reasons. So it was just interesting that you were having a discussion about would you like UK or US? And so in my family, we each have chosen to come to UK. Well, let me put it that way. It's me who has chosen to come to UK. And my husband's sister, they are in US, did USMLE, and they've gone through that whole pathway. And they did very well. Like Dr. Naveen said, yes, the finances are high. Well, their work-life balance, you just can't. I saw that they get up at 6 in the morning, come back at 10. And this is exactly even today. And it is proportional to the work that you do, which I might be wrong, but this probably worked in my case. In England as well, if you want to work more over and above that 40 hours, you could, and you could always get more money if that's what you want to do. It all depends on how much work-life balance you want. So even in our department, among 12 consultants, so one will be like, okay, I'll do 9 to 5, go home, I'm happy with it. Some people say, well, I'll do, you know what, I'm going to go do weekends as well. Some people even stay in the evening. Some people do somewhere in between. Some people just do in between just to fund certain sort of expenses. So there are different ways people do it. But anyways, this is my journey. When I was doing my radiology residency, I have done FRCR Part 1 and Part 2A. FRCR is Fellowship of Royal College of Radiology. I'm sure everybody is aware. I'm sure there are different exams for different specialities. And when I was sort of working in India, I kind of felt, well, I'm sort of jack of all trades, but master of none. I thought, you know what, I like breast radiology and maybe I would want to learn more. And that's when I started exploring about UK. I was aware of the overall pattern here and how sort of people work here because of my previous contacts or the consultants that I've worked with before. So I've sort of made some phone calls, sent some emails, finally got a clinical attachment in Margate Hospitals in March. Sorry, I think there is a typographical error in that. It's March 2014, not 2019. So in 2014, I got a clinical attachment. I've done it for a month. The reason being, I thought it was quite important for me to know whether I really want to move to this side of the pond or not. So that's the whole reason why I did that attachment, sort of understood what is normal for a regular general radiology department here. So during my time there, I kind of, I was offered a post as a specialist registrar, especially if I'm doing breast radiology. Obviously that offer was conditional and only post GMC it was offered. So at that time I didn't have GMC registration. So that's when, I started thinking, okay, how do I get my GMC registration? So GMC registration, either I can get through FRCR 2B, which I have to finish. I could have done that, but 2B waiting list at that time was around 2 years. And there was a bit of uncertainty, which I didn't like personally, that, whenever they give you, I have to take it and do it. So I thought, you know what, I can't organize my life like that. So I just thought, I'll quickly give PLAB. So that's when I did IELTS and did PLAB. PLAB, I think I started in 2014 in the beginning, not in the beginning, sorry. I did it in August. And then by the end of 2014, I was GMC registered. So that's when my job hunt actually started. So at that time, I think 7 years ago, I think there were only 1 or 2 recruitment agencies. There was not a lot of help. People have not really gone through this pathway at all. So it was just me just finding about different things online. So how do I do it? It's just a mix and match. I have no clue. So by which time I did understand, okay, how does registrations work in UK? What's basic, GMC registration, specialist registration, all those, I had a good idea of them. Okay, I rang up a couple of recruitment agencies and finally had some job interviews and took up a job finally at Y Valley NHS Trust, which is where I'm based today, in May 2015. So towards the end of 2015, I started applying for CESR. I compiled all the documentation and applied for it. And I think I didn't get my CESR first time. I got the decision for my CESR next year, middle of next year or September next year, 2016. I think, yeah, in 2016 towards August, I got my decision saying, well, we've got most of it, but we would like you to do this. They gave me 3 or 4 recommendations. If you can satisfy this in a year, we can give you specialist registration. So I was eligible for a review application. They also gave me, instead of these 2 or 3 recommendations, you can also do FRCR. So by which time, during that time, I got my FRCR. I decided to do my 2B. I've settled well in UK by that time. So I finished my FRCR and resubmitted my CESR next year. Finally got complete registration with specialist registration in August 2017. So for consultant post, substantive consultant post, previously I was on a locum consultant post. Locum consultant posts, it's not forever. They're only for a short period. They're just to sort of fill in gaps. So the idea is to get onto that substantive consultant post. So that's it. So you're on a permanent post. So only if you move, you can move. They can't just literally fire you. So I've taken up that post in October 2017. And finally, I have taken up screening breast radiology post in Worcestershire hospitals in April 2018. Again, screening breast radiology is very guarded here. So you have to have your quality assurance accreditation and all of that to become screening breast radiologist. So I've done that training whilst I was doing all this paperwork and everything during my off day. I only used to work 4 days a week. And 1 day a week, I always used to do it to upgrade my skills and things like that. That's how I've done. I started upgrading my skills whilst I was working as a general radiologist. So at the end, last year, I've taken up as the clinical lead of breast radiology at Y Valley NHS Trust. So this is just my journey. So I was just, the only reason why I put this is one way of doing it. There are many, many ways. We've got other consultants who have joined over the years in the last 7 years in our own department from India. People have taken different routes. Some people have done FRCR and come through that route. Some people have come through the PLAB route. So it really, you can decide what's suitable for you. So like I said, there are 2 routes for GMC registration, and GMC registration is mandatory before taking up any form of post, be it registrar post, any form. If you want to take up a post as a doctor in NHS, you have to either do PLAB or you have to have acceptable postgraduate qualifications. In terms of acceptable postgraduate qualification, except if you have done it in like Canada, Australia, and US, I don't think if you've done it from India or elsewhere, it's directly acceptable, except that if you have overseas qualifications like MRCP, MRCPS, FRCR, so on and so forth. There's a huge list on GMC website. GMC website is really, really useful. It literally, whichever one that you want to pick and choose, it has detailed information about every single thing and every single line. I find it very useful. So again, so that's the basic GMC registration. But if you want to head towards that consultant post and get to that top of that ladder, you have to have specialist registration, for which there are 4 ways. You could go through the training pathway in UK and do, for radiology, it's 5 years, but for different specialties, it's the duration is different. So you can do CCT, which is Certificate of Completion of Training. So that's just the usual training pathway. But if you have done training elsewhere, or even in UK, which is a non-training pathway, you can apply for what is called CESR, which is what I'm going to talk about a little more during my presentation, which is called Certificate of, I think Eligibility of Specialist Registration. So it's basically equivalence. They try to sort of analyze your training skills and knowledge to a trainee here, and whether you're eligible for that same registration or not. And there is also something called a combined program, where you can sort of, if you've done MD in India or MS in India, you can join in the middle of the program, say at ST3 level or ST4 level, depending upon where your training is at that point. There is also something called non-CCT specialty, but I don't know anybody who has got it on that, through that. But this is something, if you're a very specialized radiologist and you've done it for many years, like say you're a neuroradiologist or a uroradiologist, you're only specialized in that field, and you've done years and years of, you've got years and years of experience, and that's what you've practiced and you have specialized in, you can apply for non-CCT specialty, but on your certificate, it says, say radiology and then neuroradiology. So you can only take up a consultant job in that. So that's the problem with that. But I don't know anybody who has done that. Most of the radiologists from India, their knowledge is quite wide, and they do very well coming here. So this is CESR. Again, when I say this CESR, the evidence that I personally produced was that much. So about 800 to 1,000 pages is what I produced. And this, of course, I applied about 6 years ago. So that's the amount of evidence we have to produce, because obviously what they're trying to assess is whether our training, wherever we have trained, is actually equivalent to a trainee here. And is this person, is he or she eligible to take up a consultant post? Can he or she sort of take up that responsibility? That's what they're trying to assess. So you have to show equivalence. So equivalence is shown in different ways. So there are 4 domains in GMC, domain 1, 2, 3, 4. So domain 1 has the maximum significance and weightage when they're actually doing the application. So it's your knowledge and skills, which has about 75% weightage in the application. So you have to show that your curriculum, whatever you have done, is very similar to UK curriculum. So you see, you sort of compare both the curriculums and see, is there any gaps? If there's any gaps, maybe you should address it before applying for CSR. So what's the training duration? In India, MD is 3 years. Here, it's 5 years. So, okay, where do I pull these 2 years? So generally, those 2 years, if you have done any fellowship, that can be counted. If you've done anything else, any post except consultant post, you can put towards that 5 years of training. Or you can sort of do a combination. You can still be working as a junior consultant, but half of it, you have some amount where you have sort of always honing your skills. So that way, that's how they're going to assess the duration. So do that and see if there are any gaps, try to sort of fill it up. So that's 75% of the application. Again, a lot of people sort of ring me and say, can you help us with CSR? So the first question I always ask is, have you read the guidance? And they say, well, yes. And then when you ask specific questions, I can tell that they haven't read the guidance. When I say, have you read the guidance, it means go through that GMC guidance line by line. because sorry. Because it gives everything, what you should do for every bit of information that you're going to provide and every bit of evidence that you're going to provide. So that's exactly how they're going to follow. They're going to look at each line. They take their own sweet time to do it. Typically, they take about 6 months. And when they have analyzed my application and sent it back, I understood that, you know what, they have done a lot of work going through each paper. Even the ones probably, I forgot about, they've actually gone and looked and analyzed it very well. So be careful when whatever you're producing, just make sure you're producing the right information. Don't keep producing. If they ask for 40 reports, don't go and produce 100 reports because it doesn't make any sense. Try to sort of, stick to the guidance. It makes your life easy and their life easy. And a little bit of about 10 to 15% of weightage is given for about domain 2, which includes audits and appraisals and all of that. This is very easy when you're working in this country because that's part of the process here. But in India, generally, even though we do a lot of work and we do sort of do all the work and extra skills, we never document them. I think Dr. Mohit was mentioning about teaching feedbacks and all of that. So it's good to get those teaching feedbacks. Again, it's good to do audits. I think GMC asks about 2 audits and 1 audit should be a completed cycle. So you have to do a re-audit for at least 1 audit. So if you don't have audits, pick up a couple of audits, finish them off. It shouldn't take too long, but it's good to have audits before you apply for CSR. And definitely applications are rejected if you do not have audits. Not rejected, but they might say, well, you don't have audits. Could you come back after you do an audit? The same holds good for appraisals. So it's good if you're coming to this country and you're going to work here, it's probably wise to wait for a year or 2 when you have those appraisals in this country before applying. It's just helpful. It's not like, it's set in stone. Again, they're increasingly asking about publications and research these days. So if you have any, it will be very good. FRCR is the exam which the trainees take here. So if you do have FRCR, it's definitely a plus because really you have cleared that knowledge and skills section. You've got that tick box. But if you have FRCR, say about more than 5 years ago, you have to show that you have maintained your skills after you've finished your FRCR as well. So that's the only thing that they've asked for. So, but if you don't have FRCR, it doesn't mean that you will not get specialist registration. So this is another myth that people have. I have to have FRCR to get specialist registration. No, that's not true again. So anyways, when you're trying to compile evidence for CESR, this is exactly how you feel, or at least that's how I felt. With lots and lots of paperwork, you don't know what you're doing. We don't know whether going through the correct pathway or not. And actually, when I did it, I had one consultant who has done it, but that consultant, when he moved to this country, he was 10 years senior to me. And he worked here for, he obviously applied for CSR before coming to this country, but his level of experience was way higher when he applied for CSR. So at my level, when I applied, I really did not have any help. I just had to go through the guidance and just do it myself. So anyways, it worked at the end. So this brings me to my next topic. Dr. Naveen has asked me to cover which post to take up. Is it a locum consultant post? Do I take up an associate specialist post, a registrar post? So there are a lot of queries. So there's no clear-cut answer to this, and it is a very difficult question to answer because I feel it has to be individualized. What's okay for me, it might not be okay for another person, because their background, their experiences, their confidence, their knowledge could be entirely different. So if you are a person who have just done, I'm only speaking about radiology because I probably am not the best person to talk about surgery, because I know surgical fields are quite tough in terms of getting specialist registration. So obviously, if a person has finished MD and then just trying to understand how to work independently, that's probably not the best time to take up a locum consultant post, because that will be too much. You're coming to a new country, complete new set of protocols, and the way everybody works is different here. And it's unlikely that immediately after your MD, even if you're probably the best student in that class or in that university, it will be very, very difficult to actually act independently. In 3 years, to actually act independently completely will be very, very tough. So that's probably not the best time to do so. But if you've worked for at least say 2-3 years or 3-4 years, you've worked in different modalities, now you're at a stage where most of the reports you're able to just dispatch without any help. You only need occasional help for a very complex case, and you're confident that you can manage a department for on-calls or anybody who walks in through your door. Yeah, by all means take up a locum consultant post. There's no two ways about it. If somebody is offering you that, take it up. But GMC has changed a lot of guidance, and now a lot of trusts are not offering long-term locum consultant posts like they used to do before. Like literally till last year, we were able to recruit locum consultants and keep them on that title for about 2 to 2.5 or maybe even 3 years before they could get specialist registration and join us permanently. But we have been given strict orders that we cannot do that any longer. So these days we can only give locum consultant posts, at least in the trust that I work in. And I think it is slowly spreading across all the trusts in England, that you can only give these posts for 6 months, maximum a year, and during which they want the candidate to have specialist registration. So that's why most of the trusts are asking people, they're advertising for associate specialist posts when they're recruiting from overseas. At least that's what we have shifted to completely. So what is an associate specialist post? It's literally just one step below a consultant. You still have to act fairly independently, but your clinics or your work is usually under a consultant name. So you have a named consultant, a named mentor, a named somebody who you can go to. And if things go wrong, you're still not completely responsible, not even though you are partially responsible. And the salary is very close to a consultant, and less responsibility in general. So the problem with consultant post is that you have to take that up responsibility. Say in your team you have, say, juniors, registrars, or trainees, and you have HCAs, nurses, and you are directly or indirectly responsible for all these people. Suppose you're doing a clinic or an ultrasound list and a nurse makes some mistake, but it's your responsibility as a consultant to document it, form a datics, because at the end of the day, you're responsible for all of them, because it's your patient at the end of the day. So that's what I'm trying to say. So if you're ready to take up that responsibility, yes, go ahead, take locum consultant post. And registrar posts I think they're very good for people who have just passed. Like, they just want 1 or 2 years, get the experience right, and get all their, if they have to do FRCR or anything. Because once you have NHS post, you can do FRCR straight away. You don't have to wait for a slot. So they're very, I've got several juniors who have taken up registrar posts, finished their FRCR in a year or two. Then they moved on to associate specialist or locum consultant, depending on whether they have specialist registration or not. So that people have taken different pathways, but by far, at least in radiology, what I've noticed is people who have come from India after 4 years of working in India, they do generally settle quite well into locum consultant posts, and they are able to sort of take up significant portion of the work, and they are sort of moving to permanent consultant posts here fairly quickly in a matter of 2-3 years. So at least in radiology, it has worked well. Right. So I'm sure some of you, I'm sure different people would be at different levels. Some of you probably already have a job offer or they have things in mind. So for those people, these are the tips which I personally found it useful at different levels when I'm doing interviews or when I have just started in a department. I think you do have to present yourself well. In the sense, confidence is the key. You do have to wear it well, but wear it in the correct proportions. It should not be that you become overconfident, or at least show the other person that you're overconfident, and know when to stop. I think that is the best advice that I got when I moved to this country. One of my senior consultants that I work with him in India. He told me, you know what? It's not like India that you can say, I can do everything. It's okay to say no. It is, if there is something that you're not, if you're only 80% sure about, say no. It's better to be safe than sorry. So you have to know when to stop and seek help. Because here you have a panel of general radiologists, and then you have, everybody has an interest in something. So they can be general radiologists with interest in uroradiology, with interest in neuroradiology. So that's what they do. So take their help, get that advice, because they do a fine job. So if you don't know, it's always good to ask. People are usually very helpful. And I think I liked when Dr. Mohit said, if you go look for racism, you will find it. Personally, I haven't felt it, because I was welcomed everywhere. And to be fair, I probably was given more opportunities than a white person here. My trust when I joined, I think next year they sent me to King's College to do my breast interventional radiology training. And I don't think anybody else got it. I haven't seen it in the last 7 years. They paid for me. I've gone off for 3-4 months. They paid for my salary and they paid for my fellowship there. So they've done it. They do things. But what I've noticed, what they don't like is when you negotiate too much upfront, even before, because they don't know you. They're scared. They're equally scared to hire a new person. When I'm recruiting somebody today, I'm wondering sitting there, well, once I recruit, I have to deal with that person. Okay, how is that person? Is the person going to be good with my team? Because I feel most of us coming from India, our training is good enough to deal with all the cases and reports. But what many people lack is they don't communicate well with the patients. Because the usual complaints that I get in the beginning are, you know what, doctor, that new doctor did not introduce himself to the patient. He did not say what the patient has. So these are the things. He did not wash his hands. He did not change his apron. These are the complaints that I get, not that he doesn't know what he's reporting. So these are the ones which can easily be tackled. Like, make sure you introduce yourself. Take that extra time to get that history with the patient, because those are good clinical skills anyways. It is radiology, but it is clinical radiology. And that's what we have to practice. And be punctual, not Indian standard time. You have to be punctual. And teamwork. People love it when you are part of a team. Because multidisciplinary teams are a big part of UK's work. So it's important that, you are part of that multidisciplinary team and that you take charge of that. So people really appreciate it when you deliver good work. Because one thing I really enjoyed after coming here was because what I noticed in India is we never get feedback in terms of pathological feedback, not in a different way. So you've taken biopsies, you've taken samples, it goes off, you're so busy with your work, unless you manually actually check on the computer or go ask the pathologist, what is it that has happened? You don't usually get that feedback. But here, once you do something, it's gone to the MDT, you sit there and you get, what did I, okay, I've taken biopsy, I thought it was benign, but it has come as malignant, or vice versa. So you do get that feedback, and you get that comprehensive sort of feedback between oncologist, pathologist, surgeon, radiologist, everybody sitting there. So you develop that holistic approach in a different way. And what you also noticed is, you will notice is, you might be junior or you might just be sort of finding your way, but you could be very good. You will never know that till you start guessing yourself, doing your work and sort of cross-checking with pathology. Because at least back home in India, what it used to be like, if there is a senior person there and the senior person says, well, this is adenocarcinoma, and that's it. And why is it adenocarcinoma? He says, because I say so. And I think that culture is not there. Even everybody has to justify why they say for what they say. I think that I really enjoyed to hear. And you do build up your skill bank and everything. So, and I think employers like it when you're flexible. Obviously, try not to be over flexible that people can roll you over. And having all of these in the right proportions will sort of get you there to wherever you want to be. And final advice is, just decide what you want to achieve by coming here. Is it that you want to stay in this country, or is it that you just want to get some training and go back? That will help you decide, not doing extra work, because end of the day, you have to enjoy life. And never give up. Thank you.
Usha, that was really, really good. I'm very impressed. And then thank you very much. Very insightful, actually. A lot of very pertinent information, because there are quite a few radiologists and a lot of questions have come on in terms of radiology. If you could spare some time and go through that, we did try to answer the best we have. But then possibly, if you could review them, and then if you have a better advice, just give it. I think we are spot on time, or just 3 minutes ahead. So for this radiology Q&A, we'll do it after GMC. I guess most of the questions we have answered anyways. Just review them, Usha, when you get time.
Yeah. So shall we go through a couple of questions now, or not really?
We have answered, actually. Review them. Possibly we can do it later. What do you think, Gauri?
I think ma'am's covered. There was one question from Deepthi.
Yeah.
Who was asking, what are my options in starting my career in UK in the forthcoming years, other than FRCR? But I think you've covered that, ma'am. If you would just like to sum it up for her.
So if you don't have FRCR, you can still become a consultant here. But like I said, you do have to show your knowledge and skills and experiences to match with a consultant here or a trainee here. So it is a slightly longer route. So can I ask whoever has asked this question, at what stage of their career they are at this point?
What I've seen is a lot of them have done MD radiology in India.
Okay.
They haven't done FRCR, possibly because no slots available, or most likely that seems to be the reason. So Deepthi has answered, finally a PG.
Yeah, she's written, I'm an exam-going radiology resident in India.
Okay, so that's okay. So I think after the exams, maybe, start doing FRCR. But if you don't want to do FRCR, again, you have to take PLAB route to get GMC. You can do PLAB, come and join UK as a registrar, do a couple of years or 2 to 3 years, finish off FRCR hopefully by then, and then get on the specialist registrar. Or you don't want to go through FRCR at all, join as a registrar, work for 2-3 years, build up all the evidence for CESR, saying you have all the skills for that, and then apply for a CESR. It will be a slightly difficult route if you don't have FRCR, but it's not that it cannot be done.
Right. I think Steph Styles is here. Steph is, as I said, International Applications Manager for GMC. We know her because she attended one of our events in India just before the lockdown started. Steph is going to talk about GMC registration, not really the exact application process. She's going to summarize a bit about it. We can run a session about the application or registration process in detail later, but she's going to highlight the most important and pertinent points. So I'll leave it to Steph now. Steph, up to you.
Morning, everybody. Can you hear me okay? Right. I'm just going to get my presentation up, so bear with me. Okay. Okay, so as Naveen just introduced me, my name's Steph Styles and I'm the International Applications Manager at the General Medical Council. You probably know that all doctors wishing to work in the United Kingdom need to have registration, and that's what I'm here to talk to you about today. Just a few stats to start off with. Applications from international medical graduates have increased year on year. So just to put that into perspective, in 2015, we were registering around 4,500 doctors from overseas. And now it's more in the region of 9,000 to 10,000 doctors. So a huge, huge increase. And Indian medical graduates actually represent the highest number of doctors. Half of the doctors apply on the basis of having a pass in the PLAB test. And just so you know, it takes about an average of 30 days to process an application for registration. That can be quicker or it can be slower, depending on how quickly applicants send in the documents that we ask for. So today, what I want to go through with you are the key stages of the registration process, and how to prepare before you apply for registration to avoid any delays in the process. As I say, there's no reason it should be 30 days. It could be 10 days or 20 days, but I'm going to give you my best tips for avoiding any pitfalls in the process. I'll give you a little bit of information on what's been going on, obviously, with the pandemic and anything that's coming up. And also, I'm going to go through some of the most frequently asked questions that we have with you as well. One thing to know, obviously you're welcome to make notes throughout, but actually everything that I'm going to tell you is already on our web guidance. So I can't stress to you enough how important it is to have a look at that, because all the detail will be in there. And I also know that Naveen's going to share useful links with you as well after the presentation. Okay, so let's kick off with the 6 essential steps that you're going to have to consider first. You're going to need to have a primary medical qualification that is acceptable, and I'm going to tell you what that means. You're going to have to demonstrate that your English language skills are at the right level. You've got several options for how you're going to be able to demonstrate your knowledge and skills. So these are your pathways, as in PLAB or holding an acceptable postgraduate qualification. And I'm also going to tell you about a new route to registration that we've created. I'm going to tell you how to get your medical degree independently verified. This is something that all doctors have to do, and you have to have started this process before you're actually able to make an application for registration. You're going to have to demonstrate your fitness to practice. That's through filling out a form and also getting the right certification. And I'll also run through what the key documents are that you're going to have to send to us. Okay, so an acceptable primary qualification. Well, basically, what you need to do is just check on the World Directory of Medical Schools list. The link is on our web guidance, and Naveen will give it to you as well. And don't worry, if you've any concerns at all, just give us a ring and we'll do a check on your behalf. One thing to say is that we are the regulator, but we always look for ways to give you registration. We're not looking for ways to not give you registration. So if you've ever any concerns and the information you need isn't on our web guidance, you can always telephone us, and we've got a set of very experienced people always on hand to help you. Getting back to acceptable primary qualifications, there's 3 medical degrees to note. I'm not going to read these all out, but just have a quick look on the screen. There's just one Indian one, that qualification, that we don't accept. And there's 2 that we need to talk to you about before you apply. So don't worry about the second 2. It just means that we just need to do an assessment before you make an application for registration. Okay. You'll all know this, and probably many of you will have already sat and achieved our minimum scores in IELTS or OET. But these are the main ways to demonstrate that your English language skills are up to date. I've noted there the minimum scores. So for IELTS, it's a minimum of 7 in all elements with an overall score of 7.5 in the academic version. The OET, grade B or above in all elements. I think you know the difference between the 2 tests. One is a general English test and one is a occupational one. So it'll be, you'll take the doctor version. So all you need to do is check that your test will be less than 2 years old when you apply for registration. But please don't worry if it's slightly more than 2 years old, because there are ways that we can that you can show us that you've been able to keep those skills up to date. So it could be that you've, since passing one of the tests, you've worked in a country where English is the first and native language, for example. So there's ways to look, and we'll always consider all evidence. Moving on to knowledge and skills, well, there's several ways that you can do this, and these are the main ways that you can do this. Like I said to you earlier, most doctors, or certainly half the doctors applying for registration, do this by sitting and passing the PLAB test. Some doctors hold an acceptable postgraduate qualification. So we have a list on our web guidance which lists out all of the postgraduate qualifications that you can use to demonstrate your knowledge and skills. Some are UK qualifications and some are overseas ones. So simply go on and have a look. And as I said, we've created a new route to registration. This was in because of the pandemic, and we were having to restrict the number of PLAB tests that we were able to do in the UK. So this is the PLAB 2 clinical test. And so we looked for other acceptable overseas exams that were comparable to the PLAB test, and there's 3. So I'm going to go through which ones those are in a second. So as I said, first of all, the most common way, the PLAB test. Now the things to do to remember, if you're going to apply on the basis of the PLAB test, you must have an acceptable internship or a pattern of experience, and I'll go through what that looks like in a minute. And of course, your PLAB 2 test must have been passed within the last 2 years. So what if your PLAB 2 passes over 2 years old? Don't panic. This will still be okay, but you will be asked to provide evidence of how you've kept your knowledge and skills up to date. Okay, so an acceptable internship or a pattern of experience. Now, please bear in mind this criteria only applies to PLAB applicants. You don't have to demonstrate this if you're applying on using any of the other pathways. So it's just for those applying on the basis of PLAB. Now, we know that Indian internships are usually 12-month programs, and they're usually pre-graduate as well. So that fits exactly with the UK program. And your 12-month program must include the following, though. You need at least 3 months practice in medicine and 3 months in surgery. If your program was over a longer period, some of them can be over 18 months. You need at least 6 months practice in medicine and 6 months in surgery. The other way you can demonstrate this is by actually having 2 years continuous medical practice after you graduated, but that must be in at least one branch of medicine and at least one branch of surgery, and you need to have each branch must be a minimum of 3 months. If you're unsure, give us a ring and we'll have a look at it with you. In terms of what document you need to send to us, on Indian internship certificates, they usually reference compulsory rotating internship on them. And this is a document that will be issued by your medical college, and it includes all the details of the rotations that you completed during your internship. Now, so that's the document that you'll need to send to us. But actually, even if you're not applying from PLAB and you have this document to hand, it can be quite useful to us. So if you don't mind sending it along, it can actually speed things up. It confirms different information that we might need for your application. So it's a good document to send. Normally, I would say don't send any documents that we don't ask for. But this is the one document that could actually speed your application up if you've got it to hand. But you definitely need to send it if you pass it, if you're applying on the basis of PLAB. Holding an acceptable postgraduate qualification. This is very straightforward. Just have a look at our approved list, and all you need to do is check that yours is listed on our list. The pass date mustn't be older than 3 years at the point of registration, but don't worry if it is. If you took it more than 3 years ago, you can still use it, but we will ask for more evidence of how you've kept your knowledge and skills up to date. But your advisor will talk you through that at the time. One thing to note, if you are going to use a postgraduate qualification as your pathway to registration, you will also have to get this document independently verified along with your medical degree. Okay, so I mentioned that we've got a new route to registration. So any doctors who have passed one of these 3 different tests, you may be able to use this as an alternative to having the PLAB test. So we did a study of lots of different overseas registration exams, and we found that these 3 were most comparable to our PLAB test. So one of them is the USMLE, the United States test. Now you're going to need step 1 and step 2, but please bear in mind you need the step 2, you need the clinical knowledge and the clinical skills. And the clinical skills must be passed on or before 13th of March 2020. If you've got the Medical Council of Canada qualification examination 2, you could use that, or the Australian Medical Council clinical examination. The thing to do here is check our web pages on this before you apply, because there's a little bit more criteria that you're going to need to meet if you're using this. So it's things such as the number of attempts that you took, and various different things. So just have a look at our web pages and check that you can meet all of the criteria. And if you can use this as demonstrating knowledge and skills. If you're unsure, give us a ring. In fact, one thing to note, this is a paper application. So you will have to call us if you're using this pathway, because we'll need to get a paper application to you. Okay, so how do you get your primary medical qualification and your postgraduate qualification if you're using that independently verified? Well, this is an external company called ECFMG. And again, all of the information on how to do this is on our website. But I've made a note there of roughly what the costs are to set up what they call an EPIC account. The process usually takes between 30 to 60 days. So basically, ECFMG go directly to your medical school where you graduated or where you were awarded your postgraduate qualification and verify the qualification directly with them. The best advice, well, the only advice is you must start this process as soon as you know you're applying for registration. Like I say, ECFMG will issue you with an EPIC number, and you need that EPIC number to be able to apply for registration. You won't be able to apply online. It'll ask you for it very, very early on in the application, and you won't be able to go any further without it. It's very important. The process doesn't have to be completed. You just need to have started it. Okay, so you're going to have to demonstrate your fitness to practice. Now, the first part is as part of the online application form. There's 10 questions. 3 of them are around health and 7 are around your fitness to practice. If you answer yes to any, you'll be asked to provide additional information. Now, the best advice I can give you is to read our guidance carefully on this, particularly on minor offences, because we don't want you to over-declare. Don't declare things that we've not asked for, but you do need to declare things that we do need to know. So really important to read that guidance. Okay, so the second part of demonstrating your fitness to practice is obtaining a certificate of good standing. You'll probably be familiar with this document, and this must be issued by the medical regulator in every country you have practiced or been registered in over the last 5 years. So even if you're registered somewhere but you never practiced there, you're going to have to get a certificate of good standing. Now, most of the documents that you're going to send to us, you're going to email to us. We no longer ask for you to send us original documents into the office, but this is the only document that we'll want to see an original copy of. So if you can ask your regulator to email it to us direct if they can, or you may need to post us an original copy. The main thing to remember is get the timing right, because we only accept these as being valid for 3 months after the date that they're issued. Now, we do know that some of these documents actually say that they're valid for 12 months, but for the GMC, we'll only accept them within 3 months after the date of issue. So if you get it too early before you apply for registration, it could be that it is no longer valid by the time you're at the point of registration. So you really need to get the timing right. So I'm going to give you a bit of advice on where to get your certificate of good standing. Now, the National Medical Commission in India has taken over the functions of the former Medical Council of India, and they're the overarching regulator. But that is not where you get your CGS. I think they do issue them, but we need you to get your certificates of good standing from the actual state medical council where you've been registered or you've been practicing, because they're the body that are responsible for registration and regulation of doctors in India. So like I say, you'll need one from every state medical council that you've worked and been registered in over the last 5 years. And if you've not been registered in the same state where you've been practicing, but you've actually held registration in a different state, well, we will ask you for additional evidence of good standing, and we'll probably ask for employment references. I'm going to give you a bit more information on employment references later on. So when you've done all this, so you've got your EPIC number, you've got an acceptable primary medical qualification, you've got your certification, your good standing, you've got your English, please reread the web guidance one more time, because as I say, the more documents and the more accurately you send us everything up front, the quicker the whole process is going to be. So please reread it, and don't send us anything we've not asked for. Have your EPIC number ready, and then you're ready to log in to GMC Online and make your application. Apart from if you're applying on the basis of one of the overseas tests, as I said, that's at the moment, that's a paper application, so you're going to have to phone us for that. When you make your application, as soon as you've paid the fee and submitted it, you get an immediate response by email from us, and we'll literally set out again all of the documents that we're going to have to see from you. Now, obviously, once you've sent us the documents in, we may come back and ask for additional information. And when you send the documents to us, you're going to send them in a PDF file by email. So get them into us as soon as you can. And whenever you send us anything, we will respond to you at least within 5 working days. So as I say, the more, if you get all of the documents we ask for in right first time, this could be a very, very straightforward process for you. One thing to note, you'll have your own applications advisor who will take you through the whole process. So you'll deal with the same advisor all the way through. You've got 90 days to complete your application. We tend to close them if after 90 days, but that shouldn't be a problem because, as I say, on average, most applications are processed within 30 days anyway. So the important things, plan, prepare, and apply at the right point in time. Okay, I said I'd go through just a couple of questions that were asked most. References. At what point would we ask you for a reference? And what are the rules around references? So we tend to only ask you for employment references if you've perhaps had a gap in your practice, and you've been in non-medical work. So it could be that you can't get a certificate of good standing for a period of time. So we would usually, if it's over 30 days gap, we would ask you for an employment reference. And references, don't worry, they're not, we just simply send you a form. So all you would do is pass that on to your employer or your previous employer. It's not we're not looking for a handwritten reference, so you don't need any guidance on what we need. We'll simply send you a form, and forms are available on the website. Like I say, we might need a reference in other circumstances where you're unable to get a certificate of good standing for some reason. And sometimes, I mentioned before that we will look, even if your IELTS or OET test is over 2 years old, it could be that you have worked using English language, and at that point we probably would ask you for an English language reference. Again, we'll send you the form, and you would pass that on to your supervising consultant. It's very important that references come from official medical institutions. As a rule, we wouldn't normally accept them from personal or web mail email addresses, but we do know that some hospitals do have Gmail addresses across the world. So if that's the case, don't worry, but do ask your employer or previous employer if this is the case. When they send the reference, also put an accompanying letter with it, something on letterheaded paper, so that we know it's come from the official address. We always primary source verify references as well. Another question that's been asked quite recently, more so than ever, is obviously with the pandemic, we've had to restrict numbers of PLAB2 tests being taken, offered. And so some doctors, unfortunately, their IELTS and OET tests are over 2 years because their PLAB2 test was cancelled. Please don't worry about this. We will still consider accepting your expired IELTS or your expired OET. We'll look at other evidence. Possibly you've since passed PLAB2 quite recently. We'll take into account other evidence of English. So don't worry, we realise and recognise that the PLAB2 test being cancelled is way out of your sorry, I've just got tongue-tied. Not your fault. We will look at other evidence. Just give us a ring. We'll talk you through what else that you might be able to do. And finally, lots of doctors ask us about breaks in practice. They've had a break and worried about whether they can still apply for registration. Well, yes, we will consider applications from doctors with breaks in practice. And as a general rule, if you've graduated over 2 years ago, we'd probably expect you to have been practicing a minimum of 60% of the time. And we're looking for at least 6 months practice in the last 12 months, immediately preceding your application for registration. Again, don't worry if you don't quite meet that, give us a ring, we'll talk you through it, and we'll consider any evidence that you've kept your knowledge and experience up to date. And finally, just to let you know, we have introduced some registration changes because of the pandemic. Like I said to you before, we're trying to get as many PLAB test 2 places open. Keep checking our GMC online. Additional seats are being released. In late spring, we're actually opening a second test centre, so we'll be able to release more dates. For any of you that haven't sat PLAB 1, we're working with the British Council and suppliers, and seats are being available in locations around the world. Just one thing, for non-PLAB routes, because as you know, if you do sit PLAB 2, you have your identity check done there and then. Our offices are closed, and so ID checks have been suspended, but don't worry about that. We're granting registration anyway, and then we'll ask doctors to come for an identity check in the future. And like I said to you before, please be reassured there's absolutely no increase to application processing times because of the pandemic. So thank you very much for listening, and over to Naveen.
Brilliant. Thank you, Steph. And very important and pertinent points, very relevant to the application process for any Indian doctor, overseas doctor to come to the UK. There are a few questions which popped up, and then there were a few which were there before as well. I see Dr. Deepak Patkar is the radiologist and previous IRA president is here with us.
Hi,
He's the
Naveen.
one who started Medvirtuals. Good morning, Dr. Patkar.
Morning.
Is it okay if I just quickly run through the questions for Steph and then
Sure.
off the hook?
Please go on.
Steph, there are a few questions. Actually, I made a note of them. If you could quickly answer, there is a doctor who said, like, I've done my GMC or PLAB 2 exam a year ago, and I don't want to come in the next 1 year because of the pandemic. Will it affect my registration?
Okay, so because you need to have sat PLAB 2 within 2 years of sitting PLAB 1, is this why this will be why he's asking? I don't know what arrangements are in place with regards to that. I mean, clearly you do have to come to the UK to sit the PLAB 2. So I will take that one away. So just to be clear, the doctor has already taken and passed PLAB 1, but hasn't come over to the UK to sit PLAB 2, and is concerned that it will be over 2 years old at the time. Yes. I see. Okay. I think that we would definitely consider making an exception here. What I advise is that it hasn't actually come up, believe it or not, or certainly not with me. I've not been asked this before. I would suggest that the doctor phones our contact centre, because when they do, it'll obviously it'll be recorded on the doctor's record that he has made the call, asked the question, and the advice that they've been given. But I can take that away and get information to you, Naveen, in case anyone else is interested in that too.
Another one, I know that there has been some recent change. Earlier, it used to be academic IELTS only, which is accepted for GMC registration. Is that the same now, or even the UKVI or regular IELTS accepted?
Sorry, say the question again, Naveen. I'm struggling to hear you. I'm sorry.
Sorry, earlier, only academic IELTS is accepted for GMC registration. IELTS.
Yeah. Okay. We also accept the OET test as well.
But does it have to be only academic IELTS, or the regular non-academic IELTS still accepted?
IELTS it has to be the academic version.
Academic. Okay, right.
Got
it. Thank you. And specifically for you, if I present good standing certificate from a past job and the date is already over 3 months, do I have to contact them again for a new certificate?
I'm afraid yes, you do. Yeah.
Okay, clear answer. Yeah, that is most of the GMC related questions I have come across. I mean, if there are any more questions, what I'll do is I'll pass them across, or I'll compile them and then I will email them. Perhaps at your leisure, you can answer them to me.
Absolutely, yeah, absolutely, no problem.
Oh, there is one question actually a doctor called Priyanka just asked. Are gaps during internship accepted? Because as I mentioned previously, Indian doctors do take time off preparing for their postgraduate entrance exams, even PLAB, USMLE. So, but are they accepted towards a registration?
Yeah, we will accept gaps in internship. Obviously, there's things that people can't avoid, so we tend to it depends on the length of the gap, and it depends on the reason for it. So, but we will consider it. So don't worry too much. If it, I would suggest if it's over, 90 days, then probably best to telephone us first, just to make sure that that will be okay. But yes, I sign off gaps a lot. So generally, as a general rule, if it's less than 30 days, that would be okay as a general rule, unless there's extenuating circumstances.
Right, got it. Any other questions from our faculty to ask specifically for Steph? I mean, I think we covered all the questions here for Steph. So thank you very much, Steph. I'll pass on to the conveners. Amit and Gauri, you can lead it through. Dr. Parker, you want to put a word through us?
Sure. Shall I?
I would like, yeah. So before we move on to the final Q&A, I think I would like to invite Dr. Patkar to say a few words. Sir really doesn't need an introduction, frankly. There have been several academic projects that have been taken up in the last several years under Sir's guidance. And Sir's been, he's been providing support and guidance to not just radiologists, but doctors from other fields of medicine as well. And in spite of the difficulties, the last year has been an excellent one academically, thanks to his vision and efforts, really. Sir is the immediate past president of the Indian Radiological and Imaging Association. He's a director of medical services and the head of Department of Imaging at Nanavati Super Speciality Hospital in Mumbai. He has more than 32 years of experience in the field of radiology, leads medical administrative functions, and has been instrumental in the clinical team expansion at Nanavati. He's a past chairman of ICRI, that is the academic wing of IRIA. He is a member of the National Steering Committee for the Indigenous MRI headed by IIT Mumbai. That's a Samir project. So has delivered several lectures and has been in several conferences. He's trained several students over the years. He's been a graduate teacher for DNB for the last 19 years. He's been instrumental in shaping the careers of several radiologists in India and abroad. Thank you so much, sir, and over to you.
Thank you, Gauri, for the kind words. Good morning and good afternoon, friends. With great delight, I thank all of you, the people who talked and people who listened to today's session by MedVirtuals. MedVirtuals is a digital online platform where we shall provide educational material and information covering various aspects of medicine, academic and otherwise. The courses are specially designed to help students to prepare for various exams. We've also designed a series of carefully curated lectures on different fields of medicine, including case-based reviews, quizzes, and question and answer series. One thing that is common about all the medical students is that they would like to expand their horizons and travel to different countries to broaden their knowledge and sharpen their skills. One such popular educational mecca or destination is the United Kingdom. When I went to UK in 1989 to learn cross-sectional imaging, which was difficult to get by in India, I had absolutely zero knowledge about the application process, choosing the right place for the course that I intended to do. The entire experience was very harrowing and cumbersome. I'm sure the current students are much more accustomed and more knowledgeable, but they still have a lot of questions and miss the chances to do so because of lack of knowledge about the details, availability of opportunities, rules and regulations, etc. Thankfully, today we had our esteemed panelists consisting of Dr. Shashank Patil, Dr. Naveen Kirti, Dr. Usha, Dr. Mohit, and Ms. Steph, who shared and provided important insights and details of the entire process of studying medicine in UK and the career prospects that the country brings to us. We at MedVirtuals are extremely grateful to all of them for contributing their valuable time Sunday morning for this session. In future as well, we will be conducting such sessions, and we request you to spread word about MedVirtuals across your friends. Without taking much of your time, I would like to state your limitation, it is only your imagination. So try to learn more, try to gain more. Thank you all.
Thank you, sir, for those kind words. I think we can move on to the Q&A.
We did answer quite a few questions, Gauri. Shashank and Mohit and Usha has been active as well in answering directly. I'm not sure if there is a provision to save the chats or the Q&As and then possibly share it with the attendees. But if there are any questions, we are happy, I'm sure, actually. Mohit is still here and Usha is still here as well. Happy to answer.
Just come up. Dr. Pradeep has a question. Once I'm in UK, what all evidences should I gather to move for the post of consultant over time?
I think Pradeep is an anesthesiologist. I'm sure actually we'll run a similar anesthesia session in future as well, just like how we got a surgery and radiology covered today. Yes. But Pradeep, my experience wise, once you come in, I'm assuming that if you come over here, you come with a job, then the most important evidence, as highlighted earlier, both by Mohit, Usha, and Steph, is your experience from India. A logbook portfolio is the crucial thing. Audits and publications is the important one. But I'll leave it for Usha and Mohit, who have done most recently, to talk more about this.
So what I feel is that, again, I don't know much about anesthesia. I mean, including the application process. You like in surgery, we have ISCP, which is the main portal, through which we upload evidence. If you could, get in touch with with a trainee in anesthesia in the UK, they would definitely let you know about this portal. And another thing is that whenever you find this portal, you always need to scan it through. For example, for the CBDs and PBAs, as I described, if you cannot do it online, there are paperback forms available on most of these portals, which you can download and get it signed and submit and upload it. So I would recommend just go to some official portal of anesthesia.
Right. So this question is very generic question, okay? And the previous speakers have kind of highlighted all the information you need, okay, in United Kingdom is quite explicit and clearly mentioned in a stepwise pattern in all the websites. So there is no one, the only information, there's nothing like you pass me on this information, everything. If it's GMC, you will find each and everything about GMC, CCT route, Caesar route in detail, stepwise. So I remember who mentioned, but if you are asking this question, that means you have not read those rules and regulation. So everything is there. To answer Pradeep's question and what Mohit was just saying, speak to anesthesiology trainee. Again, this is second-hand information. Go to the Royal College of Anesthesiology website, go through the rules and regulation. I'm sure you will find answer to your question. So it is looking for this piece of information on the relevant websites is the most validated way of finding and looking for your answer. Yes, you can ask for advice, but when you read it, you can actually see, well, oh, this is the query I had. This is a query, because there is not only one question, there is a question behind a question. And these rules and regulations are quite well written in a stepwise fashion in the relevant. So your helpful websites is GMC, the relevant Royal College. You can also look at Health Education England, And these are three good websites I would recommend you guys. So whichever specialty you are, if it's microbiology, pathology, go to their Royal College and go through it. If it's anesthesiology, go to anesthesia, read anything. All Royal Colleges have all the right information. So yes, so hear from us, but go and do your own groundwork. That's the most valuable thing.
Thank you, sir. There's a question which has just come up. I think even Bhatkar sir can take this up. I'm a first year resident in MD Radio Diagnosis. After completion, should I directly apply for UK or should I get experience here in India for 2 to 3 years and then maybe apply?
It actually depends on where he is learned. If it's a government medical college where he learned and has a lot of exposure, he can take 1 year fellowship somewhere on what he wants to specialize and then can go to UK. If he's learned in a private medical college where the patient flow has been less, I would suggest that he should pick up a fellowship in a government medical college. Should have a huge workload, hands-on experience, and maybe take 2-3 years and then go abroad.
Thank you, sir. Anybody else would like to throw some light on the same question? Shashank,
Yes, I can throw some light on that.
Yes.
It again depends on what you want to achieve. What is it that you want to achieve coming to UK? Are you planning to settle? Are you want to get knowledge, go back? So it all depends on that. So or you just want a different country experience. So if you want to settle, maybe, couple of years getting it in India and so compiling the evidence for CSR and coming through that route might be good, like how I have done. But if you just want a couple of years of experience to learn something and go give it back to your own country, then it doesn't matter when you come. But of course, you need GMC.
Right, ma'am. Thank you. There's a question from Shweta here who's asking, is there an age bar for FRCA? And is there an age bar for FRCA? And she wants the email addresses of all you eminent personalities so that she can communicate with her later.
My answer, there is no age bar in the UK at all, for nothing, which is like the best. GMC registration, being a consultant, being a junior doctor, no age bar, come what may. There is ever, and then that would be discrimination against age. So I don't think, I remember one of the movies, an actor says that 40 is the new 60. So I've just entered 40. I think it is like new 20. So always feel young for your age. The second question, sorry, Gauri.
So she wants the email addresses.
Oh, email addresses. Yeah, so I'll give my email. My email address, I'll post it in the chat. Send it to me. I'll direct to the respective persons unless they're happy to share.
Yes, sure, sir.
Naveen, there's no age bar in India as well.
No, with regards to age, I think for entering a training program, that is if you take the so-called long or a long route, if you apply at a later stage of your career, you are penalized. So if you want to get through, a training pathway, the earlier you apply, you will actually see that they reward you more. Like, for example, I was under 4 years of my MBBS and I got a multiplier of all my marks, which was around 1.8. So that is something which and it's a logical thing as well, because they say that if you have entered so late into training, you probably don't require to go through the long route. So most of the things over here, they're, logical, as I said earlier.
Bear in mind, when you say training program, there is a very important aspect to this, and this is beyond academics, is that when you're in training program, it's a region you go to, okay? So if you're in London is different. London has got a very small footprint, whereas you apply in Scotland, you probably are looking at packing a tent with you when you go somewhere, because you have to move through various shires and various hospitals in this region. And programs like surgery, this is national recruitment program. So they score you and then they ask you your choices and then they match your score to your choice and you get your first choice, second choice, third choice. So places like London, highly competitive. Oxford, they are always on top couple of lists, and then the deaneries just move on. So bear in mind when you think about training programs, and if you have a big family, if you're applying for certain region, you're looking at travel of couple of hours because you still have to locate in one place and be somewhere. You can't keep moving every year to a different city or region. So these are further down the line challenges, but very relevant to know that regions do influence and huge things like personal aspect do come into picture.
So there's one more question which I think you all have answered before, but y'all could just sum it up. What are the opportunities for locum jobs apart from regular jobs? And can we do extra hours for extra pay, especially in radiology?
If I can take that.
Pardon?
I think it's completely up your alley. Asking about locum
Jobs apart
supplementation.
from regular jobs, ma'am.
So shall I take that question?
Please, if you don't mind.
Yes, please, ma'am.
Yeah, yes, you can. The answer is yes. So like I said, you can do how much ever work that you want. Most of us, there is a national shortage of radiologists in UK. So all of us generally, our regular jobs are 10 PAs. Each one PA is about 4 hours. So regular full-time job is 40 hours per week. You just have to sign a little paper saying, I don't want to be in that European directive of working more than 48 hours per week. But if you do that, then you can take up extra hours within your own trust if they need it, and then you get paid extra for the extra hours. Or you can take up extra locum job, which is outside of your job contract. If you're contracted for Monday, Tuesday, Wednesday, Thursday, you can take up a job on Friday. Or if you're contracted for the whole week and weekends you have off, you can pick up some shifts over the weekend, and you do get rewarded for your extra shifts. They do appreciate your work.
In fact, to further add, I think there is a national shortage of everybody over there, because in general, everybody works so less as compared to India. So you have these locum opportunities earlier, before COVID. You know, on the tier 2 visa which you come in, you can do 20 hours above your regular working hours. But during COVID, even that they have kind of abolished, and you can actually work 24/7 if you want to, and like you're used to.
Yeah, there is something called as a break period, so you have to have at least 13 hours of rest period. So
Yes, that's right.
so
Obviously we don't have our maids or drivers, or we are everything here, cooks. So we have to be a cook, we have to be a nanny. So yeah, so we do need time here more than in India.
There was, by the way, I think the locum is a good opportunity, because if you are normally getting paid as a full-time doctor, and obviously everyone who comes from overseas has to get a full-time job, because that is how you get your visa. Just on basis of locum, you'll never get a visa. So you should have a full-time commitment. The maximum is 48 hours per week. Average, take it around 32 to 35 pounds per hour is what you get paid as a full-time doctor. But locum shifts often get paid roughly around 70 pounds per hour. This is before tax. So yes, you get paid well. And then as Mohit said, that 20 hours is the limit. If you're working in outside your normal 48 hours, in any hospital outside who have issued you the visa. But if it is within the hospital where you are being issued the visa, you can work any number of hours. So if you're on annual leave, you can work the whole week. That obviously goes beyond 20 hours. So there's no limit. So there is always an opportunity to earn more if you decide, but end of the day, it is always the balance. So it's a lifestyle balance. One other question someone asked earlier in the chat or in the Q&As, it's like, should we apply directly through NHS or use recruitment agencies? My answer to that question is like, do apply for through the NHS jobs directly, and keep your options open for agencies. We are in recruitment agency. That's why I'm saying, don't just put all eggs in one basket. And again, it not necessarily be just one agency, because pick your choice and seek what could be the best guidance and best opportunity for you.
I probably
In
want
fact,
to add a little bit more to that. Sorry.
Sure.
It's just that personally for me, I've applied through both NHS, and this is when I'm applying from India, NHS and through recruitment agencies. I think not that, I'm promoting Dr. Naveen here, but I'm just saying that, they do have that rapport with different trusts that they can pick up the phone and get you through those posts, which are actually not advertised in NHS. And sometimes it's just, if they have a good rapport with the clinical lead, or the recruitment team in the hospital, they do kind of say, well, I spoke to this doctor and they're actually good. And you do get more options through that. And that's exactly what has happened to me. I got it through the recruitment agencies, and not for the same job, I didn't get it through NHS jobs. So it could be different for another person. This is just my own personal experience.
In fact, I would also I would actually straightforward recommend going through, recruitment agencies. Again, not promoting Naveen as of now, but in general, it's the entire process. So because, I was like one of the people who would actually have my friends fill in my exam forms, etc. So these, agencies, they make the process of getting all your documents in line so convenient. It's just another big load off your chest, including the visa application process, where to stay, and these are like small things, but it's actually like, you have a friend there. And one of the questions which I used to, when I attended one of these seminars, when I was figuring out things, I was like, so what's the catch here? How much money are you going to charge me? But you would realize that they really don't.
There's a question which has just come up. Can someone throw light on what working hours, what social working hours are, and how much they pay? Is it feasible to work at those times for a newly married individual? What the working conditions are? How?
Definitely better. I don't know where you work, whoever has asked this question. I did my entire training with 2 kids. Okay, 2 kids, young kids, looked after the family, did my exams, got my post graduation, got my 3 fellowships, service director. My kids are still young, so yeah, it is about you, how focused you are, how you channelize your energy. But it is possible, because the working time directive, as mentioned earlier, dictates how many hours you do, and the trust have to be compliant. Yes, if you take additional working hours and want to earn extra dove, then it's your prerogative. But it is possible. This, to tell you what, to keep it simple, you can have a life beyond medicine.
And if you have, at all done your post graduation in India, I feel you can survive anywhere in the world.
Totally.
And actually, with me, I did it pretty much alone, in the sense it so happened, a family tragedy happened when I moved here. So my husband has to go back and forth all the time. So I was taking care of my child, who was only 2 years old at that time, did my FRPR and did my CESR application and did my full-time job, and probably here and there worked extra to help the department. So it's all possible. And I find it's all possible. Again, willpower.
And
My
the
point.
NHS is a very, very, very supportive work environment when it comes down to family and things like these.
So my piece of advice, so if you are used to working like say average 68 hours per week in India, over here the maximum limit is 48. So you have those additional 20 hours. As we were talking earlier, or would you do locum and then earn a bit more money? I personally would advise everyone, use those 20 hours for your career progression, conducting audits, or like preparing for your exams and spending time with your family. And then once you settle down, then yes, obviously, once you have everything covered, then move into the other aspects. So keep the focus more on your career as such, rather than on earning that quick buck.
Thank you, everyone. I think we've covered most of the questions. If we've left any, then probably we can get back to them later. Sir, would you like to take anything else? Or I think we've covered most of it.
Who are you asking, kid? Naveen.
Naveen, yes, sir.
Oh, no, I don't have anything to say. And we will be running, actually, what I'll do is, depending on the interest, I'll check with Amit and Dr. Patkar, sir. run an exclusive GMC registration and visa application steps. So for those who are in your next level, perhaps this will kind of consolidate everything. Like we probably will try to get again Steph on board if needed, or an visa expert. So we can run through the steps like in 15, 20 minutes about how to apply for GMC registration and then how to get through the visa applications without making any mistakes. And in the same way, actually cover the other specialties as well over a period of time.
Sure.
Yes, sir. Sounds good. Okay, so I think it was an excellent session, and I would like to thank everyone on behalf of MedVirtuals for joining us today, all the attendees and the panelists especially. Thank you so much for joining us. Thank you for your time, especially on a Sunday morning. So hope to see you all again next time. So do spread the word. As Dr. Patkar said, MedVirtuals will be arranging a lot of academic sessions along with such sessions where we'll be providing you guidance and support for career options in UK, US, and other areas as well. So please do join us and take care, stay safe, and we'll see you all next time.
Thank you, guys.
Thank you, everyone.
Thank you, Usha. Thank you, Mohit.
Thank you.
Thank you.
Thank you. Bye.
Thank you, everybody.